Hello, welcome to the new session. The topic is tonsillitis. The picture shows the tonsils on either side of the deep part of your throat. If you open the mouth and look into the mirror, it's a clump of tissue on either side of the throat, and the bacteria and virus can get trapped here. Most of the time tonsillitis is caused by virus in the winter countries, and in tropical countries bacteria is most common. When you are having tonsillitis, there is a yellow color or white color coating on the tonsil. This you can find out on looking at the mirror with good light. So what is this tonsillitis? Tonsils are oval shaped areas of pink tissue on each side of the back of your throat, which I already said. They help to fight infection by reacting to germs and bacteria that enter through the nose and mouth. These tonsils are not bad tissues, they are good and they are needed for the body. So tonsillitis is not always bad, only thing you have to treat it, understand it, and take some preventive measures. So in this session I am trying to tell you the basics of tonsils and its infection and what you should do. The tonsillitis occurs when the tonsils are infected by bacteria, which I already said, and it becomes red in color, swollen, and sometimes you may have red colored throat, which you can see in the mirror, and you will have pain in the throat. There may be pharyngitis also. What are the symptoms of tonsillitis? They are red and swollen tonsils, which you can see in the mirror or inside the throat of your child with a torch. The baby may cry, or the adult may have sore throat and trouble in swallowing food. The lymph nodes or the glands in the neck may be swollen and painful. There may be fever, chills, ear pain, headache, bad breath, loss of voice. That is called the laryngitis. The loss of voice occurs in laryngitis. The voice becomes very hoarse, and sometimes it may be even painful to talk. In children, abdominal pain generally occurs when the tonsillitis is caused by streptococcal bacteria, and the tonsils become swollen. You may notice other symptoms, which include sleep apnea, that is, breathing stops briefly during sleep, and troubling swallowing food, which I already said, and some throat voice change, what is called throaty voice. When should I call the doctor? Call the doctor if your child has a sore throat that won't go away even without a fever. You may have to call. If your child seems extremely ill, or she is not breathing properly, or not able to eat or swallow food, and there is drooling of saliva, you have to consult your doctor. If you are an adult who has symptoms of tonsillitis, you should contact your doctor, especially if you have one or more of the following, like the sore throat lasts longer than 2 days with or without abdominal pain, fever above 103 degree Fahrenheit, stiff neck, and some weakness. An adult or child who can't breathe, who begins drooling because he can't swallow, should get emergency care right away. That's dangerous. What causes tonsillitis? Most of the time it is due to virus, sometimes it is due to bacteria. One of the virus is called infectious mononucleosis, and bacteria may be responsible for some around 30% cases. Up to 15 to 30% is the range in studies. And one most common bacteria is streptococcal bacteria. It's called strep throat. And the danger from streptococcal bacteria, if it is untreated, is rheumatic fever and kidney disease of the heart and kidney. So please treat sore throat if it is due to bacteria, otherwise your heart and kidney may get damaged. Only thing, everybody doesn't develop, say 3 people out of 1000 people only get it, but there is definitely a risk. There is especially a family history of rheumatic fever and kidney disease. How is tonsillitis diagnosed? The doctor can diagnose from taking a proper history, and he will examine your throat, ear and nose. The pictures I have already shown earlier. And the doctor will use a swab to take the secretion from the pharynx, and it is given for tests, and this will help to identify the bacteria. It may be a little nauseating when the doctor puts the spatula, but it's not that painful. Don't get frightened. The baby may cry, so the mother has to hold the child properly. And the throat culture will show the bacteria, the result will be available within 24 hours. Sometimes the doctor may even test the blood sample. That depends on your condition. And the treatment is, for a virus there is no need for any antibiotic. You have to drink warm liquid like a soup or broth or tea with honey and lemon, gargling with warm saline water. That is 1/4 of a teaspoon. That's around 1 teaspoon is 5 grams. So half is 2.5 and 1/4 is 1.25 gram in say 200 ml of warm water. The taste of the water should not be too salty. The taste should be something like the water which comes from your eyes, that is a tear, not more salty than that. Then acetaminophen or ibuprofen can help to reduce the fever and pain. Children should not be given aspirin. It can cause what is called Reye syndrome. So below 18 years, don't give aspirin. And a lozenge can help to reduce the throat pain. Then cool mist humidifier is good, rest the voice. Antibiotics are used. Most common antibiotic used is amoxicillin. Some people give penicillin, ampicillin, erythromycin. And taking the antibiotic also helps to prevent the spread of the bacteria, but you should take the medicine properly, usually given for 7 to 10 days. 10 days course is a must to prevent the heart disease. So don't stop the antibiotic after 2 or 3 days, and don't take antibiotic without prescription. If the tonsils are very much swollen and hard to breathe, the doctor may even give sometimes steroid or antihistamine. That depends on the clinical decision of the ENT surgeon. So don't take steroids without prescription. And some people may need surgery called tonsillectomy, but nowadays it's very rare to do the surgery, especially for chronic tonsillitis they may do. And it can be even done on a hospital outpatient procedure, but adult very rarely only get tonsillectomy done. And if the tonsils are untreated, pus may collect inside the throat behind the tonsils, and it may be dangerous in those cases. So such cases surgery is very essential. Then how to avoid? Say going very near to the people who have got tonsillitis is dangerous. It spreads through air and also by touching. Wash your hands frequently, and don't share drinking glass and utensils with the patient. Also avoid close contact with people who are sick. So don't go near them, especially when they sneeze or cough. And their handkerchief, towel and everything, even door handle, water tap handle, these are also contagious. So wash your hands well. There are 6 steps. Wash your front part, back part, tip of your finger, wrist and thumb, and dry it. There are 6 steps in washing the hand. And when you visit the doctor, always ask these questions. Should we treat the child with antibiotic? Is surgery needed? Can he get surgery or disease later? What should I do to make him more comfortable and also myself? Then any medicine which I should use to reduce the pain and fever? And if I have streptococcal sore throat, what are the dangers? And if any test is needed, and when should I come back to you? And if you wake up at night, what should I do? So all these things are actually discussed by the American Academy of Family Physicians 2008, and I thank this source for the information I got. So sum up message I would like to convey to you is: know the symptoms of tonsillitis. A proper history is more important to diagnose than investigation. Hospitalization may be needed in small kids with breathing problem, and all doctors should know how to examine the throat, and washing hands is very important to prevent that spread. That is the message I want to give to you. So thank you, and please subscribe to this channel.